Most everyone is a good candidate for sclerotherapy. The only thing that would be prohibitive is if we have lower extremity swelling or you have peripheral vascular disease. Spider veins can occur anywhere on the body, the face, the trunk, and the lower extremities. They're all treatable in all those areas. Commonly around the nose is very common as people age. Some of it's a bit hereditary as well. So most everyone from 18 on up are good candidates. We see spider veins in young adults as well as older people. The things you need to do to prepare for sclerotherapy are don't take any anti-inflammatories like Aleve, Motrin, aspirin for 2 weeks prior if possible, because we're trying to inflict an inflammatory response inside the vessel, so we don't want to take anything to counteract that. The second thing that we ask that you not do is putting lotions on your legs, because you're gonna there's possibility of having tapes that are going to be over some particular size veins, and so we want that to be able to adhere to the skin. But other than that, there's not really any other preparation to be had. The appointment times are about an hour. I'm actually injecting about the 45 minutes. Typically, I try to do all the spider veins and the reticular veins we can get to within that 45-minute time frame, so that all the veins are on the same level playing field. So we're treating as we go, all of them at one time. So it takes approximately 3 treatments for spider veins to disappear. It's a fading process, so it's not like an instant gratification that you inject them and go away. Actually, the larger the vein is, the easier it is to get rid of. The smaller the vein, the harder it is to get rid of. So it's actually the opposite of what most people think. So we treat the reticular veins on the initial visit along with the spider veins. So I try to treat all of them within that 1 hour time frame, as long as the patient can tolerate it. And then we get them, put them in compression hose for 3 days post-op. And you're not allowed to take those off for those 3 days. So you're going to have to bird bath, so to speak, because we don't want you to get in hot tubs or hot showers, because that vasodilates the vessels, which is we're trying to seal those off, so we don't want you to recannulate those. You can. You can treat the face, the trunk, and the lower extremities. Typically, the only restriction is you don't want to treat too many reticular veins at the same time, so you try to hold that down to about 3 cc's, which is a large amount considering how many the diameter of these tiny spider veins are. It does sting like a little bee. It itches a little bit after the injection, but pretty much by the time we're ending the session and you're getting your hose on, there's no more pain involved. And then once you leave here, we usually ask you to walk for at least 30 minutes and try not to do any high impact aerobics or jogging for at least 3 days, but walking every day is highly encouraged. Usually around the 4-week mark, when the bruising is gone away, you will start to see some fading, and you'll probably see the reticular veins gone by that point. It will take at least 3 treatments with about 4 weeks in between to get you where you want to be. I usually like to say you didn't get them overnight, so they're not going to go away overnight. So it is a process to try to get them away, and we're not changing your genetics. So what we usually do is when we get you to a happy place at about the 3 treatment mark, you come back once a year and have touch-up treatments in order to keep them at bay. Okay. The biggest side effect you'll see from sclerotherapy will be bruising. The other things you can see, which I've not had, is some necrosis of the tissue at the actual injection site. If it extrudes out of the vessel and gets into the soft tissue, it can cause a sore, so to speak. I've only had one of those ever happen in about 22 years, so it's very rare. You just have to be very cautious when you're injecting. And some itching at the site typically, but the bruising is usually the main thing that is the side effect afterwards. You don't want to do it around any type of social event where you're going to have your legs exposed, because it can take up to 4 weeks for them to disappear. But they will disappear just like a normal bruise would.